UW Health Chief Quality Officer Dr. Jeff Pothof is back in the studio with us. Hi, Dr. Pothof, good to see you.
Good to see both of you too.
Okay, so Johnson & Johnson said a booster shot, a single dose of a second shot, dramatically increases protection. What did the research show today?
Yeah, so what they're reporting is that if you get a second shot after your first Johnson & Johnson, it increases your effectiveness to 94%, which is pretty impressive. So what I think you'll see now is Johnson & Johnson doing that same process that Pfizer just completed, making a pitch to the FDA for why it might be reasonable to consider a booster dose in folks who got a single Johnson & Johnson shot. And because the numbers are a little bit different, we may see a different recommendation come out of the FDA. Maybe they'll recommend more people get a booster with Johnson & Johnson, or maybe they'll stick with that older, higher risk kind of mantra that they have for the Pfizer shot, but I suspect we'll find out in the following weeks.
When do you think this might be available? Because federal approval is still required, and they said the second shot within 2 months had the 94% effectiveness. Well, right. Most people got their first dose longer than 2 months ago.
Absolutely. That's why this is something that regulators will have to look at. You know, does it make sense? It's likely that if it works 2 months out, it probably works farther out, but they might want to see some data to support that. So I think you're looking at, at least several weeks, maybe a month or two before we hear more about people who got Johnson & Johnson getting a booster shot.
Is this another set of good news to, kind of pile on to the fact that we are, getting closer to being able to vaccinate younger children as well?
Yeah, there's so much news about vaccines right now. I think the one that you're talking about is Pfizer suggesting that their vaccine is safe and effective for 5 to 11-year-olds. That's a large group of people, and it's certainly a group that a lot of parents worry about because those kids are back in school. So we want this vaccine to go through the same rigorous process that all the other ones did. So, Pfizer saying it's good, the FDA considering emergency use authorization, then the advisory committee on immunization practices would approve it, and finally the states would say, yeah, this is good. But that could mean that 5 to 11-year-old children are getting vaccinated by Halloween, which would just be a huge relief to all of us. As a dad myself, I would love to sign my kids up on the first day that becomes available once we know that it's safe and effective.
Well, that's reassuring to hear. You would get it for your 2 young daughters.
Yeah, absolutely. I've been following COVID for the better part of a year and a half, and I get it really good, and I'd get my kids vaccinated.
So the Pfizer dose for children is a reduced dose of the regular Pfizer vaccine. Is that right?
Right. What they found is that for these kids 5 to 11, when they're looking at optimal immune response, they didn't need the full dose. About 1/3 of that dose was enough to generate a really good immune response. So that's good news.
Yeah, that is good news.
We're heading into the holiday season, and a lot of people will be traveling. Or any advice for them, this time around versus where we were at last year?
Right. Yeah. If your kids are unvaccinated, should you be traveling over the holidays?
Yeah, I think it goes into this, risk-benefit decision. So the one thing I would look at is, the travel itself can be relatively safe. Even if you're unvaccinated, we have mask requirements, things like that. But then you have to look at, what are you doing when you get to that location? Are you able to cohort with, a small group of family who are vaccinated so that those kids have vaccinated people around them? Or, are you talking about a big event like we're going to go to Disney World? That's certainly much higher risk. So I think if you have kids who are unvaccinated, hopefully they're vaccinated by Christmas. But if they're not, it's really reducing the risk that they are exposed to, which would be exposure to lots of people, especially people that you don't know are vaccinated. That would be the balance you'd have to take as you're trying to plan that travel.
Do you think getting younger kids vaccinated will be the game changer in terms of getting the upper hand on the pandemic?
I don't know if I'd call it game changer. I think the game changer is convincing all those folks who are unvaccinated to get vaccinated. That slows this pandemic right down. Getting 5 to 11-year-olds vaccinated certainly helps, but the game changer are those unvaccinated folks, that percent of people who haven't yet gotten a vaccine. To get it, that changes everything.
Yeah. Well, very good. Thank you for speaking with us about all this.
Sorry, Brady, I'm looking over my shoulder.
That's okay. Can you hear me over there?
Yeah. Well, we're trying to be as safe as possible.
Yes, safety first.
Great to see you, Dr. Pothof. Thank you for your time. We appreciate it.
Same.